Mi gente, hello and welcome to Kica Corner. My name is Kica Matos and I am your host. On this show, we talk about our community, we talk about our city, and we talk about the world. But always, we always do it through a social justice lens. It's been a little bit over a year since our nation went on lockdown due to COVID-19. The statistics in our state have been sobering. An estimated 294,000 Connecticut residents have tested positive for COVID-19, and 7,807 people have died. New Haven has been one of the hardest hit counties, with 75,750 people infected and 1,970 deaths. Not just that, but communities of color have been hardest hit by the pandemic. Simply put, the pandemic has infected and killed Black and Brown people at higher rates, exposing the structural racism that continues to plague our healthcare system. Undocumented immigrants have also been disproportionately impacted by the pandemic. Many of them have been on the front lines, serving as essential workers, but they have been denied government benefits and have had limited access to healthcare. According to a Yukon Health report, and I'm quote, "In Connecticut, we are finding greater magnitude of health disparities in COVID-19 infection and mortality among Black, African American, and Hispanic Latinx populations compared to their white counterparts." I wish I could share with listeners today that now that we have vaccines available, that Black and Brown communities have been prioritized for vaccination, and that the disparities in race have gone away. Sadly, that has not been the case. In fact, the opposite has happened. The disparities that we see today have to do with the fact that Black and Brown communities are being left behind when it comes to vaccination rates. According to recent data, at least 39% of white residents have received a first dose, compared to 21% of Black residents and 27% of Hispanic residents. Connecticut's major cities are among the municipalities with the lowest vaccination rates of people 65 and older. Fairhaven, Connecticut, has been one of the hardest hit neighborhoods in the entire state, with positivity rates several times higher than both the city and the state. In the studio with me today are two local advocates who have found themselves on the front lines of the pandemic. John Lugo is the founder and head of Unidad Latina en Acción, which is a grassroots immigrant rights organization whose membership is made up of undocumented immigrants. Dave Weinreb is an educator who lives in Fairhaven and serves on the Fairhaven management team. Dave and John, bienvenidos al programa. Welcome to the show.
Muchísimas gracias. Thanks, Kica. Glad to be here.
John, I'm going to start with you. You've been on the front lines for over a year now, fighting for justice and for services to the undocumented community around the pandemic. Talk to us about the specific challenges that undocumented immigrants have faced.
Okay, I'm in mute. Yeah, it has been a lot of issues, especially because the 95% of our members, they are undocumented. So that's an issue. The other issue is the language and also I think you were talking about the structural racism in this country, but also that's happening at the state level, So I think there is all these issues affecting us, and also the misinformation, because if you're an immigrant and you don't have the proper a lot of people they hardly use they know how to hardly use the computer and to access the real information, and sometimes they just depend on the gossips that are happening on Facebook or WhatsApp, and so there is all these challenges affecting us, and also the emotional toll. A lot of people these days, especially since we came to this country to provide for our families back in our countries, and when you find yourself, that you don't have a job, and then you're afraid, and then you have to be inside of the apartment, and you're afraid that you're going to get infected. Also, of course, that's going to cause a lot of emotional distress on our people, and also that's affecting us. So it's challenges everywhere. You know, we finding ourselves, you know, working like, I don't know, 12 hours or 14 hours a day, every day, 7 days a week, you know, because the people, we need to provide for the people, you know, the people, they don't have food, they don't have jobs, they don't have money to send to their families. Their families, they are suffering because they don't have the means to survive in their own country. So it's just, it's a big thing, you know, a big challenge, you know, and it's a big struggle.
John, ULA's been around, if I'm not mistaken, for nearly 20 years.
Yeah.
And you have always been very specific, and the organization has been very clear that ULA's focus has always been advocacy. You fight for justice, and you do it in a grassroots way. You confront power, you speak truth to power. And you have always said we are not an organization that's going to focus on direct service delivery. We'll leave that to others. All of a sudden this year, you find yourself doing both, right? I understand that ULA now has been gathering groceries, delivering groceries, going to people's homes where COVID has touched their lives to bring personal protective equipment. What has that been like? And why did you decide to do both this year? Why did you pivot?
Because we have to. I think there is no other choice that we, you know, if the people they are suffering, and we promise ourselves that we're not going to be a service provider. We're not going to be those organizations that provide food, you know, and Pampers and whatever, you know. But when you're in the middle of a crisis, there's nothing you can do. It's like if you're in the middle of, like, for example, in my country, you know, we suffer a lot earthquakes. You know, if an earthquake happens and my people, they are suffering because like the houses fell down, you need to get involved there, even though you believe that the government should be doing their job, you know. But even though we get involved in this service providing for our community, we also have been doing a lot of advocating. And since like May Day last year, we start like doing all these caravans because we feel like there is enough money in Connecticut to provide for the people who doesn't, you know, get any like federal help, you know. So we went to the governor several times, you know. So if we're giving like money for like rent assistance, it's because we get it from them, because we demand it from the government, because we pay $400 million a year in taxes to the state. So why in this time of crisis, why they cannot provide for us, you know? So we have been advocating really hard, and we're really been in their faces, you know, saying, listen, we're here. We're like, you know, like we're essential workers, you know. Who pick the food and the farms? Us. Who clean the you know, like the hospitals? Us. You know, who do the constructions in the state level? Us. And in the middle of this pandemic, a lot of people who they still have their jobs, they have been risking their lives, and that's why we have several members who die, you know, because, for example, at the Yale New Haven Hospital, to do the cleaning in the COVID areas, is they should contract companies that they hire immigrants, you know. When the 100 students in a UNH, they got infected, who cleaned their dorms before after they got sent home? Like our people, our women from our Unidad Latina. So yes, we're doing a lot of service provided, but at the same time, we have been telling the people, listen, we're providing for you, but you have to, you know, when we call you to mobilize and to us the power to give us what we deserve, you should be on the streets, and we have been doing it.
Kica, I heard you say something. Yeah, I heard you speaking to this idea of like priority and like how are we making sure that our Black and brown neighbors are being prioritized. And I think what John's reminding us is that like we actually have the ability to shift the priorities, right? Like if we understand that power is infinite and actually like community holds a ton, we can do the work of prioritization, and we are in the process of calling out what the priorities should be and making sure that if the state is not able to do it in a way that works for our neighbors and for the people that we work with, that we get to dictate what priorities will be with our actions. We don't have to wait.
Yeah. And in fact, that's what we've been doing lately. And Dave, your entry into the pandemic advocacy in a very public way has been more recent. and most notably around the Vacunate Fairhaven efforts, which speaks to exactly what you just said. Talk to us a little bit about the campaign, what it is, why we decided to do it, and in the spirit of transparency to folks who are listening, all three of us have been very involved in these efforts, and why you decided to get involved. It's not as though you spend inordinate amount of time at your house eating bonbons and painting your toenails.
Yes. So I live in Fairhaven. I serve on the community management team for Fairhaven. I care deeply about communication and effective, streamlined access, especially around health. Those are things that are important to me as an educator, as a resident, as a person, and as a white person of privilege, especially as someone who lives in a neighborhood that is majority Black and brown. I got involved in this campaign because I was excited to think through, how do we prioritize our neighborhood? How do we help make sure that the Fairhaven Community Healthcare clinic that's running at Wilbur Cross High School is able to serve the people that they're intended to serve, that this federally qualified health center is able to connect with people who live in this neighborhood who are majority their patients, but also people who are not their patients, people who are undocumented or uninsured, who might have all kinds of reasons why they have chosen not yet to vaccinate, but also to what John spoke to before, that for our folks who are working 12 hours a day, for whom emotional toll of death and destruction that COVID has caused allows people's effective filter to raise well above their eyes. We want to make sure that it's super easy for people in Fairhaven to sign up for an appointment, to get to their appointment, to get to their vaccine, to get vaccinated, to stay safe and stay healthy.
And talk to us about the framework of the campaign. What exactly is it?
Sure. So this past weekend, we launched a door-to-door effort to reach out to the over 70 blocks of our neighborhood, to make sure that we are knocking on over 5,000 doors, reaching out to over 17,000 residents, to help ensure that everybody knows how to get vaccinated and where they can get vaccinated to facilitate the process. So we divided up the turf. We recruited hundreds of volunteers. We held a press conference and a celebration, a gathering of volunteers on Saturday morning. And then we went out. We began canvassing, not just to hand out flyers and tell people this is how you get vaccinated, but actually to register people for appointments. And we booked over 130 people for appointments this week at Wilbur Cross High School. And that's just the beginning of the work, the beginning of the canvas. Just tomorrow, we're going to start making calls to everyone. We met a ton of people who were 45 to 55 years old who said, we're not yet eligible, but we're interested. So our instinct is, great, we're going to give you a call as soon as you're eligible, which is tomorrow. And we're going to get those folks signed up for appointments as well. Because Wilbur Cross, the site that Fairhaven Community Healthcare is running, has tons of capacity and is looking to make sure that Fairhaveners are getting vaccinated if they choose to do so.
What's this experience been like for you, Dave?
I've been impressed and unsurprised by the outpouring of volunteer passion. And what I love seeing, I loved the end of Sunday when monolingual English speakers, monolingual Spanish speakers who were paired up together to do canvassing work were like, this was awesome. They were making sure that these people were spoken to, and I was able to communicate with these people. And when can I sign up for the next canvassing effort? And what are we doing next weekend? And when are we tackling this street? And when are we doing Fairhaven Heights? I've just been so amazed, but not surprised by people's wanting and desire to connect and make sure people have what they need.
John, one of the reasons that Unidad Latina en Acción embraced this campaign is not just because this was an effort in terms of really uplifting our power and making sure that we are taking care of people who live in our communities who have been so brutally affected by this pandemic. But there was also a personal reason for your membership to take this up. And in fact, you were canvassing on behalf of Nora Garcia. And that's one of the reasons you took this up with so much passion and zeal. Talk to us about Ms. Garcia.
So Nora Garcia came to Unidad Latina like almost 2 years ago because she was was suffering a lot of exploitation as a cleaning, working for this cleaning company at UNH. And for like almost a year, we have been organizing and having meetings with all these workers. Then the pandemic came, and it has been really hard to, like to keep going with this campaign to bring, justice for these workers. But so because we got involved with all this crisis and providing food for the people, and and the protection gear for other people, and cleaning supplies. We forgot a little bit about the campaign, but she kept coming to the meetings every week, and she offered herself, to be like volunteers, helping to distribute the food in Fairhaven. And then she was fired from her job at UNH because her campaign to sign up other workers to denounce the exploitation they were suffering. And eventually she started working for this company, another cleaning company that provide cleaning services for the Yale New Haven Hospital. And she was there, and 1 week before she died, she mentioned she started organizing the workers again to see how we can renew or restart again the campaign again. The previous company who fired her from UNH. So one day her husband called me crying, saying, my wife just died. And I don't know, it was like, it was very painful, because she was really close to us. And then, I told her, listen, we cannot let her memory to die. And we asked the permission to her husband and her kids to like name the campaign for against the exploitation against the workers at UNH, Nora Garcia, and also I invite him to be part of like the people who walk the streets in Fairhaven. And he said yes to all those things, and that's why we have been trying to like keep her memory alive, and in a good way, like in this case is the campaign for vaccination, because like she was like complaining, I'm working for the hospital, I'm cleaning these places where I can get infected, and she got infected and she died.
Thank you for sharing that. Dave, I feel like one of the myths that we have busted in terms of these efforts so far is the myth that somehow Black and brown people aren't being vaccinated because we don't care to be vaccinated, because somehow we seem to care more about our lives than the lives of others. Talk to us about, and I actually would ask both of you to respond to this question. Talk to us about what the actual responses have been in terms of conversations with people at the door and the sheer number of appointments that you have made. You said about 140 people signed up to be vaccinated, but talk to us about what you actually heard at the doors.
Sure. Yeah, I think I certainly first want to like resonate what you said at the initial, which is that like that myth is feeling really busted. Certainly there are people who we've spoken to who have deep-seated fear, who have trauma-informed responses to like what this vaccine can mean for them and for their families. But in large part, we're talking to people who were like, oh, I tried calling a number of times and couldn't get through, or I went on the website and it was just too difficult to like work it through because like John mentioned before, systems are not yet being set up for folks who are monolingual Spanish speakers with low tech literacy. And so we're facilitating that work. There are people who didn't know that they could go to Wilbur Cross, who didn't realize that being undocumented, you could get a vaccine too, and that even if you weren't a patient at the clinic, it was free and that it was accessible to them. We've had people emailing us saying, I'm homebound, like, and haven't figured out how to get to the clinic. Like, can you come give me a shot? And that's unsolicited. That's like people who are coming to us from around Fairhaven, seeking access, seeking support. And part of the response is like the clinic's got too many, like there are too many calls now too. There's been an outpouring of interest. The phone was ringing at the clinic all over the weekend because people deeply are looking for information and for access.
That's a good problem to have, and I think problem.
Yeah. I mean, it's a challenge that, like, as volunteers, we have to work to help the clinic work through.
Yeah. John, anything to add from your end about what you're hearing at the doors?
Oh, no, actually the people, of course, it has been also a challenge, that a lot of people, they have a lot of misinformation, about the vaccine, and people hear all this crazy stuff, and so people, they, we had like a very funny, a guy who is 65, and he said, well, I just went away for a few more weeks. I want to see how many people die in Fairhaven because of the vaccine. And I said, okay, we're going to keep you sign you up. I'm going to keep you calling you. But at the same time, a lot of people, they're open to to hear, like the science behind the vaccine, and also like a lot of people trust the work that we do in the community. So they say, well, if you tell me that it's safe, I will take it. And so it has been like a good, thing, like being on the streets. I'm always pro being on the streets, knocking doors. Now, just like to be together with our people. We came from communities where like we work as a community. We again, I use these names, when an earthquake happened or a tsunami happened in Latin America, or tormenta or huracán happens, people came and they start working together. They don't wait for the government to provide for them. So being on the streets is like something that we have been doing it for thousands of years, as a cultural thing, and I said, our people have been really happy like doing this kind of work, so.
Yeah.
Dave, how long is the campaign going to last for, and when is the next big push? And for those who are listening who want to volunteer, what do they have to do?
Sure. So the campaign is in progress. There are a lot of ways that people can step in and be part of the volunteer effort. Right now, we are recruiting volunteers to do bilingual phone banking, to follow up with folks about scheduling appointments. We're scheduling folks to do some focused canvassing, especially on the business corridors of Fairhaven, making sure that all of our businesses, our institutions, are also helping to get the word out. We're going to have our next large-scale door-knocking effort on April 10th, Saturday, April 10th, which just comes right after the April 5th gate opening, where everyone 16 and over is able to participate. So April 10th, Saturday, April 10th is going to be our next large door knocking effort. And we're looking for lots of volunteers to make sure that we're not canvassing over the course of a week, but actually that we knock on every door in Fairhaven on Saturday, April 10th. The easiest way that folks can get in contact with our campaign is by emailing vaccinatefairhaven@gmail.com.
We are coming to the end of the show, and as is my practice with my guests, it is time to get personal. So Dave and John, this is rapid fire. John's looking freaked out. You can just answer the question as quickly as possible. And John, we're going to start with you to get over the pain. If you could spend a weekend with anyone in the world, living or dead, who would it be and why?
What?
If you could spend, let's say not a weekend, a night, if you could spend a day with anybody in the world, living or dead, who would it be and why?
I don't know. I think I love a lot of figures. I think I can say like maybe Nelson Mandela. And that's something that I have been pushing a lot in my community to really understand, the African experience, and for the struggle of liberation of Africa. And that's something that we're very separated from like the African American community here in this country. And I would love to spend time, because Nelson Mandela, as Che Guevara and Lumumba, they were like these fighters, for freedom. And that's something that we need, we need keep fighting, to bring justice for our community. This is the world that, we feel like we live in the country of honey and milk, and this is not true, we need like to learn from the experiences from the past to really like reach the people and try to may I don't know, overcome this crisis that's happening to us right now.
Dave?
I'll offer two personal answers. One, my parents both had COVID for about a month last March, and my dad was hospitalized for a few days. And so, yeah, them being alive, them being healthy, me being able to spend my time with my dad last Saturday for his birthday sort of feels like, to a certain degree, all I need. I also feel like, for me, yeah, I mean, every day, I think you said every night that I spend with my married partner, who's a nurse practitioner, is the person who I want to spend the most time with. So that's my personal answer for you.
I hope she's listening, because she's going to give you a lot of love because of that response. John.
And I hope my mother doesn't listen to me, because she said, why didn't I choose me?
John, if you could wave a magic wand and make one social justice dream come true, what would it be? That's you, John.
I'm sorry, my connection is not good.
Oh, if you could wave a magic wand and make one social justice dream come true, what would it be?
Oh, right now, legalization for everybody in this country. Beautiful. Not the 11 million. I think it's like the 25 million people that they need, like that. What we have been like having this dream for decades, and this is what we need right now.
Thank you, Dave.
For every school to be an LGBTQ affirming, welcoming community.
Thank you. Folks, that brings us to the end of our show. Thank you for listening. John and Dave, thank you so much for being on the show. Until the next time, here is wishing you justice and many, many days of sunshine.
Thank you.
Thanks,
Peace.
Thanks, John.
Gracias.
Ibaratile ijere bi jedu la menti be